Welcome to the NICU Today Podcast, a podcast to give families a new point of support as they navigate the NICU journey. Thank you for listening. Please don't forget to subscribe wherever you enjoy your podcast and share this episode with anyone who might find it helpful. Welcome back to the NICU Today podcast. I'm really looking forward to our conversation with today's guest. Mary Farrelly is a certified NICU nurse, doula, and educator dedicated to bridging the gap between the clinical NICU world and real-life experiences of families and support professionals. As the founder of the NICU Translator, she provides evidence-based education, compassionate guidance, and advocacy for NICU families and the professionals who support them. Through her courses, resources, online community, and work as a NICU doula, Mary is on a mission to make the NICU experience more empowering and less overwhelming for families and caregivers alike. Welcome, Mary, to the NICU Today podcast.
Thank you so much for having me. I'm so excited to be here.
We are happy to have you. I do have to tell you, Mary is one of our favorite names. So our twin girls that we welcomed, extremely premature, our daughter who passed away, her name is Mary, and it lives in our hearts. It's just one of our most favorite names. So I'm happy to have a Mary on the NICU Today podcast today.
Well, I'm honored to share such a special legacy.
Yeah. So tell us a little bit about you. What led you from the NICU to kind of moving out of that clinical setting to help support families?
Sure. So my journey to where I'm at, you can always look back on your journey and be like, oh, that made sense. But in the moment, it was a little bit winding past. So my initial degree, I was pre-law and I minored in Italian. Very useful for my current job, not at all. But I went back to nursing school thinking I wanted to be a nurse midwife. So I went through a second degree accelerated BSN program. Got my first doula certification during nursing school and worked as a community doula with teen moms and low-income families. And I went into my first nursing job assuming I would go into labor and delivery and follow that path, but they didn't have a labor and delivery job at the hospital I wanted to work at. But they're like, we have a NICU position. Do you want to try it? I was like, sure, why not? So I took that job, and that was 12 plus years ago, and I never looked back. So the NICU community, those babies just wrapped me right around their little finger, and I can't imagine working with any other population. But throughout my nursing career, I have been in lots of different roles. I've worked at the bedside pretty much consistently for the 12 years, but also as a nurse educator, charge nurse, team lead, and really started to see the gaps in where we just were basically like going from 24/7 nursing care for families and doing discharge planning and prep, but then just kind of being like, okay, you're done now, like off into the real world we go, without having that bridge between that NICU care and life after NICU. And so I decided after I had my second daughter and I had my own pretty serious bout of postpartum depression and really struggled and was like, if I am a NICU clinician with years of experience and this is hard for me, how impossible must this feel for families? So I took my doula knowledge, my educator skills, and my nursing career, and I packaged it all together and started the NICU Translator almost 2 years ago at this point, where I really work on bridging the gap between the NICU and home. So it's been a winding path. I still work very part-time in the NICU to keep my skills fresh and remember about that experience. But my focus now is really that life after NICU and continuing care with specialized and individualized support.
Well, it's so important. And I completely agree with you that transition home. We have a new NICU family advocate program. We actually piloted it with a health insurance company and a hospital partner. We're in our fourth year now, but we've expanded it as a core offering because we do see not only the time spent in the NICU, but also the transition home where there is that gap for families and trying to see what they need to transition home and how, looking at rental assistance and needs that families have where they left the NICU, they may not have a support system in place. They don't know who to call. I mean, it is a scary time to be transitioning home. Take that, but then also the emotional piece on it. So that is something I want to talk to you about. Going through the NICU journey is one chapter. We say everything's a chapter. So when we talk to families, we go, you're going to get through this chapter or chunk of time, and then a new chunk of time or new chapter starts. So NICU is one chapter. Getting home, and especially if you have a baby with a medically complex child, or if you have an extremely premature child who is going to need early intervention services, That's a whole new chapter to try and navigate through. I was just talking to someone about that earlier this week. How do you recommend for parents to advocate for that smooth transition home and to be prepared for that?
That's a really great question, and it's as you said, it's so nuanced because there's so many different flavors of NICU baby. But no matter whether you've spent like 4 hours in the NICU or 400 days, the transition and how it changes your postpartum and your parenting perspective is pretty universal. Like it really leaves an imprint on in the NICU where there's more of this like top-down power dynamic where you're rounding and the team is offering suggestions and you're there to collaborate. Where at home, you're kind of steering the ship and you flip into that like pilot advocacy role. So I like to suggest if families are already still in the NICU, to start wearing that hat early. Like start owning your child's medical care as much as you can, whether that means like making sure that you're present during rounds, being asking what resources you need to know to be able to be informed about your child's unique care needs because that's a big thing that happens is there's such a learning gap in the NICU experience because people don't prepare for the NICU. You might not know about prematurity and reflux and all the many different things that come with a NICU baby experience. And so I recommend you start that early and have those conversations about discharge planning. Even if you can't see that date coming, like start talking about it. And one of the key parts of a post NICU experience is the relationship with your pediatrician. And a lot of times when I work one-on-one with families as a NICU doula, I see frequently that maybe the pediatrician that they chose might be because they were close to your house, or they're very kind, or they worked really well for your other well child. And you might find that they maybe don't have the same skill set or the same experiences with working with a more complex or premature infant. So I would start choosing your pediatrician really thoughtfully and asking maybe around who specializes in preemie care, who specializes in whatever medical complexities you might have, because sometimes there is this disconnect and it can feel really hard for families if your discharge paperwork says one thing, but your pediatrician is recommending another thing, and then your GI specialist is saying a third thing. Being like, okay, well, what do I do from here? So building that relationship and making sure that the NICU's communication from whoever you choose to your outpatient facility can be really helpful to kind of um, smooth that transition so that you're not having to retell your story over and over and over again.
Well, and you can get different feedback. I mean, I remember, and here it is, over 14 years ago, but I remember the NICU follow-up clinic that we took Claire to, and our pediatrician and our early intervention physical therapist all provided some different feedback sometimes as it related to Claire's tone or her physical therapy that she was going through as a 23-weeker post NICU. And so you do have to kind of sort through that information, figure out how you ask as many questions as you can, keep your journal, write down all the feedback from each of the entities. And it's so important to find a pediatrician that you really trust, because at the end of the day, they're the ones that are with you long term until your child grows. I mean, we were just in there last week, right? So the idea of building that relationship and asking your NICU, who do you all typically send families to? They oftentimes will have a list of local providers that you can call and interview. And we did an episode a couple of years ago with Dr. Andy Lubell, wonderful local pediatrician. And he said, interview your pediatricians that you're going to. How have they worked with NICU graduates? And if you have a preemie, how have they worked with preemies? That's just so important to do. So talk to us a little bit about feeding, because I think the feeding in the NICU, you're trained how to feed your baby, whether you breastfeed your baby, bottle feed, a little bit of both, all the nutrition for your child. And then you transition home. And I remember we kept a steno pad where when I went back to work, God bless her, our caregiver who took care of Claire, she wrote every single time she ate and how many milliliters she ate or drank and all of that. But talk to us about feeding. What are some challenges that you see? What
Yeah,
advice do you have?
feeding is a universal thing that most NICU families are working through, whether it's volume and weight gain and nutrition, or reflux and comfort, or some combination of all of those together. So one thing that we don't typically do a really great job in the NICU of talking about is normalizing the fact that reflux is a common piece of the puzzle for preemies, and also talking a little bit about like the pathophysiology behind it. Like, why does it happen? Because as you said, every baby's a little bit different, and so a parent's job is going to be able to advocate for that unique baby's unique needs, whereas a pediatrician or physician is going to maybe see like the broader picture and give more generalized recommendations. So I do feel like, to a certain extent, having some data to be able to explain yourself, especially if you're seeing symptoms or discomfort or things with babies, to be able to advocate for your baby within the pediatrician or whatever physical specialist you're seeing, saying like, this is specifically what I'm seeing, because you're going to get a lot more detailed and specific advice rather than these more generalized statements. But one of the things to remember is that, especially when a baby first comes home from the NICU, and especially if they're a preemie, is that their GI system is still maturing. So just like their lungs are growing and their body's growing, their GI system went from not doing anything inside of the womb to like going all systems on. And if it's a preemie, that's a long trajectory of time to grow and develop into that kind of efficient system. So a lot of times you're going to have, some issues on the exit, and then a backup, and eventually you're going to see this spitting up on the other side. So one thing that you can do to help with that type of reflexes is starting to like practice it again in the NICU. So a lot of times you may be using, a lot of NICUs will use those disposable bottles and nipples that come from like a provider, that they're not designed to be reused multiple times, but oftentimes families are getting discharged on those bottles, but they're not designed to be reused. So I would suggest starting to practice in the NICU with whatever type of bottle or breastfeeding system you're going to be using at home, so that you can troubleshoot it there with the eyes of your
Great
trusted
idea.
NICU team and the speech language pathology team that's there, the PTOT, so that you can have a set plan for the actual bottle. And then going home, I always suggest also to continue to not push the babies. A lot of times we focus on volume, but the long-term picture is a lot about quality. So trying to contain expectations for your baby and encouragement and calm, positive feeding experiences are going to, in the long run, have those building blocks to be able to grow and develop and mature into a more efficient feeder. But it is a process too. So there's so much to talk about with feeding. I do like a 2-hour workshop on feeding because there's so many layers to it. But know that it is not uncommon to have feeding issues, but that there are so many ways to help support a baby and a family through them. So getting to know your own baby is key.
Well, and I love your suggestion of bringing those bottles in, and you can test a few different types of
Oh, sure.
bottles in the NICU to see which one will work. We may have been a family that had a box of disposable bottle nipples that we would use, and then we may have done that for a while because we didn't want to change anything that Claire was drinking. And this was back in the day where there wasn't as much donor milk available in the NICU. Claire had a lot of formula at the time, and she would only drink that pre-made Enfamil formula that
Of
that
course.
she, of course, right? I mean, we tried. Now she was 15 ounces, so she got whatever she wanted for sure. But it was a challenge, and I think I wish that someone had told me that long ago. Well, let's go try these different bottles. Let's do it with the wonderful NICU team on hand to help before we transition home and try to feed her on our own and do all of that. Um, we talked about finding the right pediatrician. We talked about, doing some research there. But when you graduate from the NICU, there are so many other follow-up appointments that you need to schedule, whether it's pulmonary or, heart check or, oh my gosh, neurology, whatever, a family early intervention, right? There's a lot of other appointments that need to be scheduled. Where do you start? What's the most important call to make first?
That is, yeah, it's a lot. It really is. I think that shock to your system of like, okay, like there's a lot of logistical pieces of the puzzle to gather through right here. That is a really, I feel like that's a super hard part of the transition to home, because you're like, okay, well, how do we get in and out the door a couple times a week, and how do I manage my other children through this? But I would say ideally, in many NICUs, they're making those initial appointments for you. But if it is a specialist and like developmental pediatrics or cardiology or whatever your unique baby's needs are, those appointments are really hard to reschedule. So one thing, and that happens like, oh, it's on November 25th. It's too close to Thanksgiving. We're going to reschedule it. And then all of a sudden your next appointment available isn't until June of the next year. So I would just encourage you to do whatever you can to get those appointments and get there without needing, I mean, life happens, but they are typically hard to get into and get a spot even in those clinics because there's just not enough specialized providers for the demand. Which can be frustrating at times. But I think that one of the things that you can do is also, again, build that relationship with your pediatrician so that they can kind of be at the front seat, the helm of your ship, and making sure that you have a really great system for tracking your appointments too. So whether that's a spreadsheet or a color-coded calendar, a lot of people will just, the second they get an appointment, they'll put literally like a timer in their phone so that it goes off. Same with if you have a baby that's getting medications or even the vitamins. Use technology to help support you in a way that means that you can let it live outside of your brain because your brain is going to be dealing with a lot. But one versus the other, they're all important for different reasons. I think focusing on developmental support, making sure that you're seeing that NICU follow-up clinic, if that's an appointment that you're given, is really important because those are the people that typically know your baby's story. And you oftentimes will see lots of providers in that one appointment. So it's like killing a lot of birds with one stone. So those are very important for following the different chapters of life
Yeah.
after NICU. And eventually you graduate from certain programs and you shut that chapter and move on to the next one. But there is a lot to manage.
There is. And I have said this in previous episodes as well. Early intervention. So follow-up clinic is one thing. Early intervention, check with your local services within your county to see what's available for early intervention for your child. The sooner you can get that appointment scheduled, those are free services for families to take advantage of, where therapists typically will come to your home to help your child. We credit our PT who worked with us through early intervention with helping Claire to learn to walk and truly giving us as parents the skill set to help her to be successful in learning how to climb steps and pulling herself up to reach toys and what kind of toys we should get. I mean, it just is invaluable. So make sure to schedule that early intervention.
Definitely. And a note on that too is some babies, if you have a shorter NICU stay, may not by definition qualify for it. So you may not be offered early intervention off the gate, but you can almost every program you can self-refer. So
Yes.
even if you think that like you just want to get a second set of eyes on your kiddo, if that's going to help your anxiety or just help you have a plan, you can self-refer. So you don't even have to get your pediatricians. You can just find whatever specific phone number is. It's different for each state, so you do have to find the unique one for your state, but self-refer and start that program early and often. And worst thing is they're like, you're great, you don't need us, and then off you go. But if not, you at least have that second set of eyes on your child who's just for them and having that one-on-one time.
So important. All right. We're talking a lot about the babies, right? We're talking about babies coming home, transitioning home, preparing for baby to come home. How about the parents? How do you do work to help support the parents in that transition home and making it through?
Well, one of the key, as you said, a lot of times when a family has a baby in the NICU, the first thing that they come to me as the bedside nurse, and they literally forget that they gave birth. It's just like, I don't matter, all about the baby. And depending on the timeline of your trajectory for the NICU, you may still be physically healing from your postpartum experience. So whatever that looks like, making sure even if you're still in the NICU, that you are getting the appropriate nutrition, rest, hydration, and support so that you can physically heal successfully. So then you're able to then focus on your baby when they come home. So that's step one. Whether that looks like delegating to somebody else and saying like, hey, you just need to like feed me. People want to help you typically in your life. They just don't always know how. But I feel like for NICU families, what I've heard universally is like the food piece of it is something that often is forgotten. And so giving people easy, healthy, delicious key because no one's going to like look and eat this like weird quinoa salad if it doesn't taste good when you're postpartum. But it can be super key. So building your nest is what I call it. So in the NICU,
Mhm.
if you know you're getting closer to discharge, mobilize your support team. Have them go home and clean your house. Have them stock your freezer. Do a grocery run. Say yes to the help. And if someone's saying like, "Oh, let me know if I can help you," say, "Great, go to Target for me. Go pick up some paper
Yeah.
towels." Like put your
Set up
people
a
to
meal
work.
train. Set up a
Yes.
meal train. When we were in the NICU, we had people deliver meals for months, and my colleagues at work, they delivered meals, but that meal train piece, maybe it's every 2 to 3 days. But if somebody says, "What would be the most helpful for you?" And I always tell people if they're family or friends listening to this, and I have a dear friend who just stepped right in, right? And don't ask, "How can I help you?" Just do. You can't do the right
Yes.
thing wrong, so just do what is in your heart to do for someone, whether that's sending them a gift card, a Grubhub gift card, a DoorDash card, or some local restaurant gift certificate, or setting up the meal train. You can't. That's great, right?
Yes.
Someone's not going to tell you what they need, so step up and just step in there to do what you can for them.
Yeah, there's a great new website called supportnow.org. I don't know if you've seen it yet,
Mhm.
but they combine meal trains plus GoFundMe's plus like a
Oh,
task rabbit all in one
wow.
spot. So you can have, and a lot of NICU families have started to use this. You can have this one central page. You can use it just for updates. If you don't want to, mass text everybody, she gained an ounce today, you can put it on the feed, but people can help. You can put specifically on here how you would like to be helped, and then it just kind of manually does it for
Mhm.
you. And you can delegate it, to your sister, your mother, whoever, to run it for you. So it's a
Wow,
it's a
that's great.
technology, man. It's the best.
Oh, that's so great. So we're talking about preparing to go home, but I do think there's an emotional toll on families when you leave the NICU. I always say they had to kick us out the day that Claire graduated because we're like, "Are you sure you're sending us home? We've been here over 100 days. Are you sure?" But that emotional toll, what are signs that mom might look for showing postpartum anxiety, depression, getting home? What are some symptoms?
Yeah, I think something just to know and to normalize as a NICU family is that the most recent statistic is that about 70% of NICU families have some type of perinatal mental health issue, whether that's postpartum depression, anxiety, or OCD, and about 40% have clinical PTSD symptoms. So statistically, you're likely going to have some type of this experience because the NICU can be so disruptive to the hormonal shifts and the social shifts of becoming a new parent, and you add all this extra stress to it. It just sets people up. So having a plan in place can be extremely helpful, whether that's if you already have a therapist, great. If you tell your partner, here's how to set up an appointment for me. But some things to look for. It's trickier with NICU families because with a well baby and a less traumatic delivery type scenario, someone's having more of those anxiety type thoughts, you can rationalize and be like, "Oh, I'm worried about my baby breathing." You can say, "Oh, like, look at them sleeping their bassinet. They're breathing healthily and well." But for a NICU family, you've seen your baby not breathe. You've seen them hold their breath. You've seen them struggle. So there is a flavor of healthy anxiety for a NICU family because you have to maintain that certain level of hypervigilance and concern and safety as you transition to home. So there's a healthy piece of it. When it becomes beyond that is when it's really you see it starting to impact all areas of your life. So for postpartum depression, that tends to it shows in many different flavors, but it tends to be a lot of intense overwhelm, crying for no reason, not able to sleep. That one shows up even if you are bone tired, exhausted, you just cannot sleep. Feelings like you kind of want to run away from everything. With anxiety, it tends to be also intrusive to the point of you not being able to function. Sometimes you can't even see it yourself, too. Sometimes in NICU families, we also see this manifest as a postpartum OCD, specifically related to like germ management. So I have to wash the bottles this exact specific way, or else this will happen. Like this
Mhm.
very if this then this thinking. But even if you're just like, I just don't feel great, reach out to somebody. A great place to start for anyone that lives in really internationally, but in the United States is Postpartum Support International because each chapter has a warm line. So you can, if you're like, I feel weird, or if you're supporting somebody and you're like, this person's not really doing great and I don't know how to help them, it's a warm line. You call, they're like, what insurance do they have? What area do you live in? And they'll find you a provider that has availability and help start that off. Because I would say most NICU families should just, my perfect dream for any postpartum family in general would be to have a pelvic floor therapist, a mental health therapist, and some type of feeding support universally. But since that doesn't exist right now, I feel like building that into your own toolkit and just normalizing it and seeking help early is the key to getting through to the other side.
Yes, and I'll add to that too. I will say, as a lost mom who had twins and lost one of her daughters, I look back all the time and say, gosh, I wish I would have sought out some support earlier than I did, just to help navigate the grief and the joy and all of those mixed emotions. So love all that you said. Tell us where listeners can find out more about the NICU Translator.
Sure. So my
And how
two
to work with you.
places that I live, I'm on Instagram. I'm at the NICU Translator. I share a lot of just NICU education and resources there. And then my website is the NICUTranslator.com. I have two specific pathways for families. For anyone, I have a free community called Life After NICU where people can log in and there's a forum of information that's peer-to-peer, but we also have a lot of professionals in there. And then we offer monthly expert sessions in there too. So we just had someone from early intervention come in and talk, and then we'll have lactation, and that's totally free. And then I also work one-on-one with families as in virtual NICU doula. So if people want that like kind of hands-on bridge to care, I offer virtual services as well. But I'm here just to build education and community and resources. My other part of my business is building education for doulas and other support professionals who are boots on the ground working with families and need that specialized NICU family and baby information. So I focus a lot on educating and building a whole army of NICU informed professionals who can help support families in the way that they need to be supported.
Love it. And last thing I always like to ask, what's your biggest piece of advice for families?
My biggest piece of advice is to remember that the NICU is only the beginning. So the NICU is an intense part of your story. There's probably a lot of grief and joy mixed in together, but it is just chapter one, and you have the whole rest of your life together with your child. And those are the moments that really make a difference in how you're going to parent and how your relationship is going to build. And there's so much joy ahead.
Wonderful. Mary, with one of my most favorite names, thank you for joining us on the NICU Today podcast. Really appreciate all of your insight.
Thank you for having me.
Thank you for tuning in to the NICU Today podcast, brought to you by Today is a Good Day. Learn more at todayisagoodday.org.